Good, happy Friday morning, September 18, 2020. I'm Riley King, and welcome to the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Friday morning, so let's begin. First up, let's begin with your COVID-19 updates. Let's take a look at the coronavirus latest COVID-19 data information for New Hampshire. And here is a look at that information for all of you right now. There are 7,814 number of people in New Hampshire have tested positive for COVID-19. 6,657,900 number of people in the United States have tested positive. 438 number of deaths from COVID-19 in New Hampshire. 725 number of people have been hospitalized with COVID-19 in New Hampshire. And 397 number of deaths from COVID-19 in the United States. Let's take a look at this map of New Hampshire where current cases of COVID-19 are. Manchester 32. Let's take a look at this map of New Hampshire where total cases of COVID-19 are. Manchester 204. And now let's take a look at this chart here. Let's start with the first chart here. New cases each day in New Hampshire. In the purple, daily new positive COVID-19 cases. In the orange, new hospitalizations. And in the red, deaths. And now let's take a look at this chart. Current cases. In the purple, total current COVID-19 cases. And in the orange, current hospitalizations. Now let's take a look at this chart here. Total cases. In the purple, total positive COVID-19 cases. In the orange, total hospitalizations, red, deaths, and blue recovered. Let's take a look at this chart here. Age group of cases, female and male of cases, and risk information. Let's take a look at this chart here. Infections, hospitalizations, and deaths. Let's take a look at this chart here. Deaths, percent of New Hampshire population, race/ethnicity of cases, and hospitalizations. And a reminder, your common symptoms: fever, lack of smell, cough, difficult breathing, chills, nausea, and vomiting, and diarrhea. How it spreads, and prevention tips. And be sure to stay with the Riley King Network for the latest of your COVID-19 information. Increased testing at New Hampshire colleges has led to daily uptick in cases, but it isn't surge, officials say. Let's take a listen to that video from WMUR News 9, Jason King. And we can tell you there have been 7,814 known coronavirus cases in New Hampshire, officials say.
For over 85 years and 4 generations, award-winning Palmer Gas and Oil has been serving communities throughout New Hampshire, northern Massachusetts, and southern Maine. Oil, propane, and
State epidemiologist Dr. Benjamin Chan says that over the last couple of weeks, the number of positive COVID cases has increased by about 15 per day. But the state is now administering about 3,000 tests per day, and sometimes 4,000 to 5,000, meaning the infection rate is only about 1% or less. Still, positive cases are expected.
What we expect to see are the numbers to go up and down, right? We very rarely, with any kind of data or tracking of infections, see just a complete flat line.
As far as schools are concerned, officials say they are not seeing a lot of transmission in the classrooms. Even though the number of positive cases in younger people has increased, the testing protocols have worked to limit the spread.
This can all be managed. I think that's what I think a lot of folks are seeing across the state. It's all very manageable.
The University of New Hampshire has done an impressive job managing the virus, according to Dr. Chan, testing about 15,000 students and staff since the end of July, equating to about 86,000 tests. But he says testing is not the only answer.
We also need to be incorporating the social distancing, the face mask use, the good hand hygiene, the cleaning and disinfection. We look to implement all of these layers of protection as barriers to preventing COVID-19 from spreading.
Now, Dr. Chan says a key data point in recognizing a second surge of the virus would be a dramatic increase to the infection rate, which again in New Hampshire right now is only about 1%. In Concord, Jason King, WMUR News.
Okay, and there you go on that video and that report. First Lady Melania Trump visited Concord Hospital to discuss treatments for opioid-dependent newborns. First Lady joined by on DCP director at event. Let's take a listen to that video from WMUR News 9, Kristen Carosa.
I decided to enroll in Empire Beauty School because I've always had a passion for skincare. My future's headed in a career where I can...
First Lady Melania Trump got a first-hand look at how Concord Hospital cares for newborns who have been exposed to opioids.
Every 15 minutes, another child is born with NAS, dependent on opioids and facing a fragile future without medical help.
In her time as First Lady, Mrs. Trump has traveled across the country to witness the devastating effects of drug abuse. She created the Be Best initiative to combat opioid use and to create a safer world for children.
Sadly, as we see today, there are also pregnant mothers who are struggling to escape the grip of addiction, as well as innocent newborns, babies impacted by drug exposure.
Jim Carroll, the director of the National Drug Control Policy, says he was touched when he met one of the mothers in this program.
What amazing courage she has to be able to come forward and ask for help.
Concord Hospital relies on an eat, sleep, and console approach to wean babies from addictive drugs with the help of cuddling. The goal is to use minimal or no medication.
We recognize addiction is a disease, and we educate and support our clinical teams to show compassion in the same way we would any other condition.
Mrs. Trump also spoke to firefighters right here in Manchester about the work they're doing to deal with drug overdoses on a daily basis. Reporting live in Manchester, Kristen Carosa, WMUR News 9.
Okay, and there you go on that video and that report. Sununu enters general election with big cash advantage over Phelps. Latest campaign filings cover period through last week's primary. The campaigns of Republican Governor Chris Sununu and Democrat Senator Majority Leader Dan Phelps filed their final pre-primary fundraising numbers Wednesday, and as expected, they show a big cash advantage for the incumbent. Friends of Chris Sununu, the governor's campaign organization, reported raising $70,049 from August 31st through September 8th, date of the primary election, at a total of $1.34 million so far in the current cycle, adding $150.25 left over and carried forward from his previous campaign, brings Sununu's total receipt to $1,501,542. His campaign total expeditions have been 717,462, leaving cash on hand of 740,8479 entering the general election. Phelps reported raising $25,916 between August 31st and September 8th, for a total raised of $1,108,132 during the election cycle. His expeditions to date were $1,039,654, leaving cash on hand to 68,478. Governor endorses dozens of New Hampshire law enforcement reforms. Sununu plans executive orders, legislative proposals. Let's take a listen to that video from WMUR News 9.
Imagine a shampoo bottle becoming your kid's slide.
The Commission on Law Enforcement Accountability, Community, and Transparency made 48 recommendations in its final report. And today, Governor Chris Sununu endorsed all of them.
There should be nothing political about the recommendations here. They were agreed to and done in conjunction with law enforcement, done in a very bipartisan way, and therefore having a bipartisan piece of legislation for what will ultimately be the most comprehensive reforms in law enforcement the state has ever seen.
The recommendations represent a wide array of changes, from more clearly defining the roles of school resource officers to a body camera policy that will now lead to a mandate for state troopers, to creating a single, independent, statewide entity to receive complaints about police misconduct. A number of changes are already underway at the Police Academy, where there will be more of an emphasis on diversity training, both for new and current officers. Some recommendations will take executive orders, and others prompt towns and cities to act. And for the changes that need legislative action, the governor says that work is beginning right away.
I've asked the Attorney General to lead the effort to craft the legislation. One thing we don't want to do is wait for the next legislature to come back to start the legislative process. We want to start that today. So the Attorney General will lead that effort to craft the legislation.
And the governor is calling for the majority and minority leaders of the legislature that will be elected in November to co-sponsor this package of legislation. He feels there's enough to get behind here that Republicans and Democrats can agree on all of it. Reporting in Concord, Adam Sexton, WMUR News 9.
Okay, and there you go on that video and that report. Stock features are flat in overnight trading after Dow snaps a 4-day winning streak. Stock features held steadily in overnight trading on Thursday after another sell-off on Wall Street led by major technology names. After rebuke from Trump CDC director backed by top disease experts. Let's take a listen to that video from ABC News.
Good evening, and it's great to have you with us here on a Thursday night. We have a lot to get to. That storm, the remnants of Sally now turning deadly, the rescues tonight, and the tornado watch up right now. But we're going to begin tonight with the coronavirus here in the U.S. and the CDC's dire new forecast that the death toll could be 218,000 American lives by October 10th. That's just 3 weeks from now. And tonight, the feud between President Trump and the scientists. President Trump telling Americans that the head of the CDC, Dr. Robert Redfield, was wrong, that he was confused when he said an initial vaccine could come in November or December, but that it will be well into next year before millions of Americans get it. The president suggesting a different timeline, one that could mean a vaccine is ready before the election, and the president claiming it would be available right away. Leaders in the medical community tonight coming to the CDC chief's defense, hoping to offer the American people a more realistic timeline. But in a polarized country and with politics at play tonight, what the American people are now saying about whether they even trust this vaccine is coming without political pressure. And so we begin with our chief White House correspondent, Jonathan Karl.
Tonight, the nation's top medical experts are backing up embattled CDC Director Robert Redfield, as President Trump calls Redfield confused and mistaken about when most Americans will be able to get the COVID vaccine. Redfield told Congress that even if a vaccine is approved this fall, it will take many more months before it is widely available.
I think we're probably looking at late second quarter, third quarter, 2021.
President Trump says he called Redfield directly to tell him he is wrong, an extraordinary rebuke to one of the top experts on his coronavirus task force.
I think he made a mistake when he said that. I believe he was confused.
The president has repeatedly suggested the vaccine would be ready before the election and available to the general public right away.
We're not looking to say, gee, in 6 months we're going to start giving it to the general public. No, we want to go immediately.
But Dr. Anthony Fauci said even if a vaccine is approved this fall, it likely won't be ready for the general population until the middle of next year.
The idea of getting the entire population that wants to get vaccinated in a month or two, that's going to be very, very difficult to do.
The head of Operation Warp Speed, the Trump administration's effort to develop a vaccine, recently said essentially the same thing. While some 20 million doses may be ready for vulnerable populations by the end of the year, for the general public, it will take considerably more time.
We will ramp up the manufacturing of vaccine doses to be able to, based on our plans, have enough vaccine to immunize the U.S. population by the middle of 2021.
Joe Biden says he will trust the scientists, not the president.
The president, who by his own admission downplayed the threat of the virus, leaving a staggering number of Americans to die.
Tonight, the CDC projects 218,000 Americans will have died of COVID-19 by October 10th. But the president has been trying to convince voters he has done a good job handling the pandemic, saying the death count would be much lower if you don't count states controlled by Democrats.
If you take the blue states out, we're at a level that I don't think anybody in the world would be at.
It was a comment roundly condemned, including by New York's senior senator.
What kind of demented person would say that those American lives don't count?
And Joe Biden tweeted, "The job is to be president of all Americans. For the love of God, start acting like it." And tonight, another former member of the Trump administration has turned against the president. Olivia Troy, who served on the coronavirus task force as Vice President Pence's Homeland Security advisor, tells the Washington Post that President Trump has a, quote, flat-out disregard for human life.
When we were in a task force meeting, the president said maybe this COVID thing is a good thing. I don't like shaking hands with people. I don't have to shake hands with these disgusting people.
Tonight, Vice President Pence said Troy sounds like a, quote, disgruntled employee.
And so let's get right to John Karl with us live from Washington tonight. And John, we know President Trump is also fighting the CDC director after what Dr. Redfield said about masks, that masks might be more effective even than a vaccine. But there's also news coming in on masks tonight that reports that as far back as in April, the post office was planning to mail out 650 million masks to American families nationwide, but that plan was shelved.
In fact, David, the plan was so far along that the post office actually drafted this press release back in April announcing it. The press release was just obtained by the oversight group American Oversight, and it details 650 million masks to be sent out working with the Department of Health and Human Services. The White House did not respond to our questions about why the plan was scrapped, but the Washington Post is reporting that there were concerns at the White House that the plan sending out all those masks would cause Americans to panic. David?
All right, John Karl leading us off tonight. John, thanks.
Hi, everyone. George Steph.
Okay, and there you go on that video and that report. And that does it for this Friday morning edition of the Riley King Newscast, right here on the Riley King Network. Thank you for watching. Have a great rest of your day, and I'll have a news report coming up in a little bit. Goodbye, everyone.